was really struggling with the Australian accent because it's sometimes if you don't understand, if they laugh, you just laugh. That's it. That's all you do.
Hi guys, welcome to LDFS podcast. Today we have someone special joining us from Australia. She is an oral pathologist. She has cleared the ADC exam in the first attempt itself. She has been mentoring a lot of exam students as well. In today's podcast, we'll be talking about a lot of interesting topics like the salary of a dentist, how to find a job in Australia. We'll be talking about the licensing exam in depth and in detail about how a practical is conducted. If you're planning in now or in future to migrate to Australia, listen to the whole podcast and you will get a lot of insight from it. Trust me. Let's welcome Dr. Darshika Gandhi. So thank you so much, Darshika, for coming to our show. It will really help a lot of fellow dentists who actually are aspiring to go and work in Australia.
It's my pleasure, actually. It's an honor, Laksh. So you're doing such a good job helping with all your videos. So it's really good.
Thank you so much. So all the followers who are listening, actually, me and Darshika, we were in graduation together. So it can happen that during this whole interview process, we will be calling each other by our nicknames. So
oh yeah,
don't mind with that.
I absolutely forgot that, but yes.
First of all, we would like to know that how is Australia? How is the weather? How did you find it?
Sure. So I think Australia is really, really beautiful. Personally, I'm in Melbourne at this stage. Like I have when I migrated to Australia, I have always been in Melbourne.
Okay.
Telling the truth, the weather of Melbourne is a bit harsh during winters. Like the winters are really harsh, meaning it's windy and the days are really short. But it's a beautiful place to live in. At this stage, I'm loving it. And but of course, so you have different places as well. Like Sydney is. So if we compare Sydney and Melbourne, it's more like Mumbai, Pune translation. So Sydney is like a little fast paced and there the weather is also comparatively good.
Okay.
But Melbourne is a little slow paced. The weather is a bit harsh, but okay. I'm loving Melbourne.
How far is Sydney and Melbourne?
Sydney, Melbourne would be 7.5, 8 hours drive and 1.5 hours by flight. Yeah.
Okay. So you're working in Melbourne?
Yes. Living, working in Melbourne. Yep.
Awesome. Great. So, do you miss Bombay?
I miss the food. Yes, terribly. But I'll tell you what, like living here, one thing is for sure, you're away from your family. So you have a lot of those baggages, like, you're completely independent. You do everything. You make the decision by yourself. You live by yourself. So what I found very important here was to have very good set of friends. Okay. The friends are your family here. So if you have good friends, that's it. It's sorted. Like you're going to be really fine living by yourself.
Awesome. And the friend circle which you're talking about, is it mostly Indians or is it a mixed community?
So thankfully what happened with me was when Kunal, because I got married and I moved here. So Kunal had done his master's here. So his friend circle was already ready. Like he had all his friends. Okay. Indian, everyone was Indian, but mixed culture. And it was very easy. But once I started preparing for ADC, I got in touch with the whole background, like, from all over the world. I had a lot of other friends that I've made, and then that's how you get in touch. But yeah, so it's a mix of both, I would say.
Awesome. So I really still remember the college days when we used to come to your house and we had that fafta and jalebi at morning. I think 7 you went somewhere and got it for us. So I still give that example to my husband and tell him that, okay, I miss that. Okay, whenever I'm going to Bombay, I have to go to our place and have that. We don't get that in 100%. Bangalore itself, in spite of staying in India. But
no, that is a bit of a challenge to get here as well. So I'm telling you the fact, okay, you'll find a lot of Indian restaurants, a lot of Indian people, but the taste of food that you have in India, the variety, you will 100% miss it. So yeah.
Definitely, definitely. And how far is it, the flight journey? How long? I mean?
From India, so yeah, so from Mumbai, if we even take a direct flight, I think there's a direct flight from Delhi, Air India, which takes 13 hours, 12 and a half to 13 hours directly to Melbourne. So
Ah,
that's how long the flight is. If you take if there is a halt, so if you take go via Singapore or Thai or something like that, then I think it's going to be around 16 and a half, 17 hours. That's about it. So pretty good.
okay, okay. And
Yeah.
as you told that Kunal, yeah, like you got married to Kunal and then you shifted.
Yes.
So you were
Yep.
on a dependent visa, or how was it?
Oh, yes. So for me, it was easy because Kunal already had his permanent visa ready by then. So I came here as a on spouse visa.
Okay.
But there are many different ways to come. So actually, interestingly, the permanent residency that usually is needed to come to Australia, it varies. So it would be really good for everyone who would like to come to Australia to have an eye out. Because what happens, the system, the way it works here is it's a point based system. So you need a minimum of say 60, 65 points. There are certain questions for example, depending on your age, you get 5 points. Depending on
Yeah.
how much you have studied, you get 2 points, 3 points, 5 points. So you need to make a sum total of 60 to 65 at least minimum, but more the points, it's going to be easier for you to get a PR. That makes sense.
So the points, just elaborate. Can you elaborate? Like what are the parameters
Yes.
they look at?
So there are many. So it is right from your education, right from your age. How much of work experience do you have? Do you have a master's degree? Uh, do you have anything extra? Like, do you have any added extracurricular activities that you have done in different, charitable foundations? So many different aspects, but mainly related to your profession, your age, and your education.
Okay.
Yes.
And can we, like, is there a website or somewhere where we can check what is our points and then increase it accordingly, or some other medium is
Oh,
there?
yes. Yes, we do have a website. It's what is it called? I can look into it, but it is present even if you type it on Google,
Okay.
like PR points for Australia, you'll get that a website. I think it's immigration website,
Okay.
something
Okay.
related to the immigration. So you'll find it very easily, and the points also keep on changing depending on the demand. So say this year there is a demand for doctors and the medical professionals. So they will have more chances to get PR compared to other professions. So this that is why it is important to have an eye out as to what Australia is in need of, and then the PR points will differ accordingly.
So that's
Easy, yes.
interesting. So one more thing I wanted to ask you is, as you told that the requirements of Australia, right? So
Mhm.
do they publish somewhere that these are the requirements, or how to check whether, like, as a general dentist, I want to migrate to Australia. Okay. So
Yeah.
how will I check whether there is a demand for that or not?
Usually they don't publish it. It's
Okay.
just like because I work in this field right now, I know that yes, there is a demand for the dentist at this stage. But the way they reflect it is on, like, again, the PR points. If they want more doctors, the the PR points will change accordingly for that field. If they want more IT professionals, the PR points will change in that field. So
Okay.
depending on the demands. So as of now, the nurses are in demand. So if there is anyone who's had a nursing experience, they will have more advantage over other professionals.
Ah, okay. Okay. That's good.
Yes. So it keeps on changing. It is very fluctuant.
Okay, great. And as you told, you came on dependent visa, right? So if
Yes.
somebody, like if I want to shift over there, but I don't have a dependent visa, so how can we shift, and how easy or difficult it is?
So there is one way is definitely your permanent residency. It takes
Hmm.
some time before you. So say if you are actually really inclined towards doing it,
Yeah.
if you start today, probably we are looking at least 8 to 12 to 14 months before you know if it's going to happen or not. So that's a really long time. The other way is work visa. So you can come and work here. So basically, it's just the same way how it works in other countries. The work, the people, what do you say? The person here should be sponsoring your visa. So that's
Okay.
how the work visa works.
Okay. So before getting the license, I can apply for a work visa.
No. So the work visa that you would be looking here for will be very different. So then you will be working in different fields, like maybe like a dental assistant, a receptionist, or maybe just at some supermarkets and things like that
Hmm.
to
Okay.
start off with. But just to have an idea as to how things work in Australia and to live in Australia, that is another way. So the place, in fact, where I'm working currently, we have had two or three of them coming from overseas. One is from the US, one is from Ireland. So they have come here on work visa and they're working as a dental assistant.
Oh, great. Okay. Okay. So you can work as a dental assistant, and there's no licensing anything for dental assistant, right?
Not necessarily, no. Even I have worked as a dental assistant without any certificate. We'll come to that story later,
Yeah.
but yes.
Okay. 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 Good. Good. So, okay. So, like, if I want to relocate to there, then I can go there. So, I have to visit Australia on a visit visa first, and then apply for the jobs over there as a dental assistant or anywhere else other than the dentist,
Uh,
and then we can get the work visa, and then we can, simultaneously we can apply for the ADC exams, etc. Right?
yeah, yes, yes, yes. So I just to simplify it a bit, right? If you just want to give exams, you can just have your tourist visa and come here and give your exams.
Okay.
Work visa, you don't need to come and visit Australia at all. You can just search, look for jobs from there. There are many options even from India itself. You can look for jobs. As far as you're getting some sponsorship for your visa, the government will be happy. That's it. That's all
Okay.
they are looking for. And then
Uh-huh.
the third option,
So,
yes, sorry.
sorry to interrupt. So, how do we get the
No, no.
sponsorship? Like, I understand from the if it's a dependent visa, then from the husband we can like it can be sponsored.
Yes.
If
So
the first time we are visiting, how is it?
So say you're looking for a job, right? So you're looking for a job, you apply for a job online from India saying that I'm planning to come to Australia. I'm a dentist, but at this stage I would like to work as a dental assistant. And you send your resume, your CV. If they're happy to take you in, they sponsor your visa. So then you just need a letter from them saying that yes, I am happy for her to work for me as a dental assistant. That gets added to your visa application. You send it across, they accept it, and then you come here.
Okay, okay, that's good to know. Actually, that's really helpful because when I went to Dubai, the thing was there even the dental assistant, if we have to work, we have to get a license for that. So it was little
Oh,
different scenario.
different.
Yeah.
Yes, yes.
Okay, great.
Here there is a shortage, so you can work as a there is untrained dental assistants and then trained dental assistants. So obviously
Um,
there's going to be slight difference in the pay rate, but
hmm.
then you can still work as a dental assistant. And recently, actually, since this topic is already up, the Australian government, because of COVID and everything, so the immigration had reduced a lot to Australia. So just to promote immigration, they had um, they had opened up a space of work visa, just like any work. Like people can come for 6 months to Australia, just and start looking for a job after coming to Australia. They don't even need a work visa beforehand. They
That's good.
come, they look for yes, and then they work for 6 months. So
Okay.
that's the maximum time period that they can work for. And if the job, like the owner is happy and even the employer is happy, the employee is happy, then they can sponsor their visa, and then the work visa becomes like a permanent. So it's almost like a temporary permanent residency. It was in the same way for temporary work visa and permanent work visa sort of a thing.
Yeah,
So with Australian government, Yeah. So with Australian government, it's a bit tricky. The best way would be to continuously follow the immigration sites because they have something or the other coming up to promote immigration, to promote certain professions, depending on what shortage is there.
Awesome, awesome. That's good actually. That because that's a good way of shifting. I mean, if you want to migrate over there,
Exactly.
that's a
Yes.
easy way.
It's
That
a
we can
very
get a
good
work
way.
visa in
Yes.
6 months at least. We don't have a
You
headache.
get an
Our
idea.
visa is over and we have to go back. And how,
Exactly. That's
like,
true.
let's suppose. Oh, and you mentioned earlier that the whole licensing process, it takes a lot of time, right? So how
Yes.
long is the
Yes.
ADC process, and how much does it cost?
It's a tricky one. Uh, okay. So to briefly explain, ADC has two exams. So, but they're in three parts. Okay, so the first part is your application process, wherein you require basic documents saying, stating, and proving that you have completed your BDS from so and so country. This is what your transcripts are. Transcript is very important. This is not something that we follow in India usually. We have mark sheets, but overall, it would be a great idea to have your transcripts ready because that is what they look for. So basically, transcript is everything that's summarized from year one to year four in the same sheet. So all
Oh,
your
okay.
marks, everything's written together.
Okay, and it is given by the university or the college?
The college provides you that, but
Okay,
that is the most important document
okay.
to have. So that is number one. And then they also require the good standing. So it would be really great if everyone has an up to date good standing, like the registration from the respective states, because that is important as well. They need the good standing character certificate. Like for us, we have our registration with MSDC,
Huh,
Maharashtra State Dental Council. So, you know how every year we do a renewal of our
huh,
registration?
huh.
It is very important to have that because only then you get a good standing certificate.
Okay, okay. And
Yes. So those two are the most important things because that is something that you will not have normally.
and any other documents,
Yes.
if is it required, like any recommendations or any, like what about work
Um,
experience, anything?
if you have work experience, ideally, yes, it would be really helpful for you. Not necessarily always, but it just reduces your headache later for the later registration part. So you need a work experience letter signed by that particular person, like, you know, wherever you've worked, your employer, with a stamp and date. And that's about it. Like very basic documents that we always have handy, our degree that is present, the transcripts, what else would be there? Not necessarily. So all your education, basically your 10th standard, 12th standard, and then your BDS, your masters, if you've done your masters, your work experience.
Ah,
Yes.
okay. So they see the 10th and 12th standard, all the certificates and everything.
It will be yes, yes. Like how do you get your BDS? So you would have done something else as well, like
Okay.
this from the start, and then your birth certificate as well. I think if I'm not wrong. So just a proof, your birth proof.
Okay.
So that is also required. Yep.
Awesome, awesome. And in fact, I was going through the ADC website that day. So
Yes.
they have actually elaborated it pretty nicely in the website
Very
itself.
well.
It's,
Yes.
yeah, it's like,
Yes. Everything's written.
yeah, with every
Everything's
details
written.
and all the documents, everything, they have written it so
Yes.
nicely that I would
Yes.
actually ask the followers to go through that once so that you have better idea
Sure.
what you are explaining. They'll understand it better.
Yes.
So that's
Yes.
definitely
100%.
awesome.
ADC website is very elaborate. They have explained it everything very thoroughly. So it would be a good idea to go through it. There's a lot of information given, but even if we understand probably 10-20% of it, it's going to be really helpful. It just makes your process easy. That's it.
That's great, great, great. And I have read somewhere that a recommendation letter or something like that, or anything like that, is required nowadays, or like only the the basic what you mentioned. All those details are required. Any other than the
It
transcript?
it it helps. So if you have someone saying that yes, you were a good student, you know, you have been a good student, or you have been a good professional or employee, it helps a lot, but not necessary because I know I have a quite a few friends who have never worked, so they've just completed their BDS and they migrated to Australia, and they don't have any work experience, so they don't have any of those letters at all.
Okay, okay. So that means there's no minimum work experience or anything required to apply for ADC. We can directly
No.
apply it after our BDS.
Yes, you can. You can
Okay,
100%.
great,
Yes.
great. So can we actually do that in between the internship period, during the internship period?
Yes, 100%. So again, we'll just get back to the ADC process. So the first is your initial, what do you call registration process. So
Hmm.
that is important for them to verify that yes, you are the right person, the details are right, and they have you in the ADC list. Then comes the second. So once that is approved, you can apply for part one. So part one consists of the written exams. It occurs over 2 days.
Okay.
So there are four papers over 2 days, and
Hmm.
each paper is of 3 hours each, basically.
Okay. Okay.
Okay.
Okay.
So
Is it multiple
the
choice?
patterns, it is multiple choice usually. Yes, it is multiple choice.
Okay.
Uh, um, and the patterns have been changing since the time I have given my exam. So I appeared for my exams in 2019, and now that I have heard, the patterns have changed. So basically, what they do is it's very simple. I'll tell you the fact, right? It's not difficult. They give you a
Okay.
question booklet that is there. So the questions are from the booklet. It's like
Oh,
an
is it?
open book exam. Yeah, most like 90% of the questions are from the books that they have. It's easy. You just go through those questions.
Okay.
Yeah,
So
tell
they
me.
give the booklet, like the ADC itself give, like they provide that.
No. So ADC doesn't provide anything. But over the years, there have been people who have given exams.
Collected.
They
Okay.
know yeah. So they've collected the questions and they've made those booklets saying that these are the basic questions. And usually, if you do those questions, the past papers, and there are a few books that ADC recommends, again, everything is given very well in their handbook. You
Okay.
just do those areas, and 97% of the questions are going to be from those.
Okay. And
That's it.
awesome. That's good. So how to get these question banks?
Yeah, that's the question bank. So with the question, so when I was preparing for the exam, there were multiple what do you call Facebook forums groups.
Hmm. Hmm.
I had not taken any classes then because I would just refer those papers. I would just refer the forums and the groups, the various doubts and questions that were solved there, and that was it. But now, what I have understood from other students is that they have changed the pattern a bit. So what they do is they give you a scenario saying
Oh,
that, say a patient has come, he's angry for so and so reason, this is what has happened, so what do you think would be your treatment? And then they give you multiple choice options, and you select either one, two, three, whichever or how many ever you think is right.
okay. So
So
scenario-based questions are more right now.
yes, scenario based questions have started now, so that has changed a tiny bit, but I think you have a lot of help with respect to part 1. You will find a lot of Facebook forums, groups. There are many classes that have started helping them as well. It's just a bit tricky because basically the people who have passed the exams are taking the classes. So I mean, I don't know, if you ask me, I wouldn't be able to say that yes, this one particular person is the
Hmm.
best to go to for part 1.
So have you personally taken any coaching?
Not for part 1. No, I did not.
Okay. So part one is a theory exam which we were talking about, right?
Yes, yes. Now,
And
yes, the theory exam.
okay. And this,
So
sorry to interrupt, this can be given in
no,
India
no.
also and Australia, or like how is it?
Yes, that is exactly what I was saying. So it can be given from India. So say, coming back to the question that you asked earlier, say if you're doing internship and you have decided to come to India, you can start the process, sit your theory exams immediately. There are few sites from where you can, like, it's not present everywhere. There are probably one or two locations in the main cities, and then you go and you sit for the exams.
Okay. And do
And
they like have a time frame, like during this month only you can give exam, or we can choose
yes,
any day like that?
no, it happens twice a year. So I think the first time is in the month of March, April, and the second is October or either March or April. And that's the same date all over the world. So it's not just me happening giving my exam in Australia. Everywhere it's the same date.
And the first step, which you told that where the documents are to be submitted, is it like we have to physically go there and submit something, or is it just the copy we have to submit online?
No, it is all online mostly. But the one thing that you have to, so there are two options. One is obviously you can even mail it to them. So they have their post box number and you just mail it to them. But recently, after COVID, I think they've started the online process as well. So you just submit all the documents online. And just that one good standing certificate that is required directly from your dental council in India or anywhere else, or the university, that is to be sent directly by the dental council to the ADC forum, the ADC office.
So they have to send it directly.
Yes, it shouldn't go via us. It should be, so we request, so for example, for me, I requested Maharashtra State Dental Council to send a good standing certificate to the Australian Dental Council. So they give us the form, everything's ready, but the postal address, like the to address, will be for ADC directly from MSDC.
Okay, and do they charge something for that?
Yes, it is different for every state. I think for Maharashtra, it is 500 rupees for each good standing letter.
And they'll send it personally to the ADC directly.
They won't send it personally. They'll give it to you. You have to send it on their behalf personally to ADC.
Okay, it's like that. Okay. That's why I thought, okay, they'll post it. Oh, okay. Okay. Understood.
So you post it or you courier it, but under their name. So on their behalf.
On their behalf. Understood. Understood. Okay.
And coming to the prices as well, I think it is still the same, or maybe it has changed a tiny bit, but it's for the first initial document processing, it's $660. And then for the part one, it's $2,000.
Okay.
So with part one, you can give it how many ever times you like for 3 years. So basically, from the first time that I think it is 2 years. Sorry, my bad. It is 2 years. So from the time your documents are accepted,
okay,
they are processed, you have 2 years time to clear part one.
Oh, okay. So we can.
Yes, and
so every year there is twice. So that means 4 times we can write to clear the part one exam.
Part one. Yes, but each time, if you attempt, it's $2,000.
Okay, and how much is 2,000 like Australian dollars to India? Like how much is it?
It's 1 lakh, 1 lakh rupees.
1 lakh, 1 lakh rupees.
Nearly 1 lakh rupees.
Okay, and 660 would be around 40 something.
Yes, it is 40,000.
Okay,
easy.
So application will cost you around 40,000 approx, and the other one will be approximately 1 lakh. The first exam for every attempt.
For every attempt, it's 1 lakh.
Okay. Okay.
And that's about it. Now, once you clear your part one exams, so to clear part one exams, you have to clear all 4 papers. So it's not just, you have to have all 4 papers that are cleared. And you need, I think, a basic of 50-60%, and you have to pass. But now, again, with the passing system of ADC, it's very weird. No one has been able to really understand what and how do they work. It's very tricky.
Okay.
So there are many things that we have heard, but I'm not too sure. They have explained it very well with some formulas, but no one actually knows. But basically, it is more of a percentile basis. So even if you get 90% marks that are right, but if 99 of 99 others are getting more than you still fail.
Okay, understood. So how many people are appearing according to that? The percentile basis, the passing marks varies.
Yes. Yes, it
Okay, that's why I
changes.
think I have read that the ADC exam is little, difficult to pass.
It
It's
is
not so
difficult.
easy.
It is difficult.
And to
It's
tell
not.
our followers, you have cleared both the part one and part two in just first attempt. So that is
Yes,
really mind blowing.
no, it was, I think I was just blessed and very grateful. I think things just worked well. It's not difficult. I will not say it's difficult, but there's quite a lot of, there are many aspects that play a role here. It's not just you being good or bad. It's just so many things. At this, even today, we don't know on what basis are they actually judging you. Like, how are they giving you marks?
That's tricky,
No
actually.
one has any idea. No, yeah, that's the worst part. Like, if you know how to crack,
Yeah,
it just
then
makes
it's
it
easy.
easy.
Yeah. When it's based on the percentile,
Exactly.
we don't know the other person how they are performing, right? So it's a
Exactly. Yeah.
comparative results.
Now we come to part two exam. So part two exam is a practical exam. So when I say practical, again, let's divide it into 2 days.
Hmm.
One of the days is a communication and small tasks. So basically, when I say communication, they really take it very seriously.
Okay.
It's almost like a very small room. There are two examiners sitting there.
Hmm.
One of the examiner will be scoring you, will be marking on how you speak, what is the explanation that you're giving. The second examiner acts as a patient, and there is a scenario that's written there.
Okay.
So let's just take a very simple scenario at this stage. The scenario says there is, say, a 21-year-old female that has come to your clinic and has presented with a sore spot or an ulcer on the buccal mucosa. Uh, Kindly do the diagnosis and treat the patient.
Oh.
So you yes, so, and there are many different scenarios. Like till date, there are 66 to 72 scenarios, and you can get any six scenarios out of these.
So these
Any six.
62 scenarios which you have mentioned, that is there in some booklet or like the same which you mentioned
No.
earlier?
Yes, no booklets. There are nothing mentioned in the booklet, but everyone who has given exams, they have now they have now understood how ADC works, and there are certain sets. So again, each set has six of these scenarios, and there are 10 to 12 of such sets. So the same set comes in the exam. So if you get, say, set red, the six scenarios are fixed. So those are the six scenarios that are going to come in the exams.
Oh, okay.
So, and I'll explain in detail later as to how those sets are also divided. But so coming to the same example, let's just continue there. And then you start with the basic, like, the whole communication as to first how you greet the patient, then you ask the history taking. So what all questions will you ask in this particular scenario? So you ask all the necessary questions that is important. Then you talk about the investigations that might be required. Then you talk about the diagnosis. So it will be a differential at this stage because we don't have anything definitive or a provisional. So you give all the differentials, then you say, but most likely it appears to be the provisional diagnosis, that is after ulcer in this case. What would be the treatment for that? And then you conclude it. But to do all of this, you just get 10 minutes. So in 10 minutes, you have to complete the whole scenario.
One more thing is, does the accent, like they have different accent, we have different accent, right?
Yes, yeah. Doesn't
Does it
matter.
affect?
No, no.
Doesn't matter.
No,
It's
no,
okay.
no, that's not at all. Even when probably I'm not sure, I don't have as much heavy an accent. I hope I don't, but sometimes when you talk to patients, you do develop a bit. But when I was giving my exams, it was a typical Indian English accent. I don't know if
Okay.
they understood or not, but they are very nice. It's
Okay.
easy. It's fine. Yeah.
Okay. Okay. Great. So that's good. So these six scenarios which you have told, in every scenario,
Hmm.
it's like this, or like how is it? The two scenarios are
No,
like
it's
this, which you have
different.
told, right?
Yes, so it's different. So again, each set is divided into three subsets, right?
Okay.
So the first two will be just the diagnosis part. So you just diagnose. They give you a scenario, they give you symptoms, and then you ask for signs, and then you come to a diagnosis, and then the investigations that are required. Okay. The second one would be there is more information that is given. They what they ask is they ask you to diagnose, and they ask you to manage the patient. So maybe the patient is going to be angry, the patient's going to be sad, the patient's upset, or things like that. The patient is in a lot of pain. So you manage that whole scenario. Then the third is treatment planning. So a lot more information is given. X-rays are given, everything's given, but you give a proper treatment plan for that particular scenario. So if it can be an endo consent, it can be an exo consent, it can be a patient who is really upset and has come with a swelling on face. So what's your treatment plan?
Okay.
So that is what it contains.
Okay. So Dashi, like working in India, and let's suppose like the same example earlier, where I'm doing my internship over here. What we study in college is something really different from the scenarios which you have told, right? The kind of treatment plan, we don't know anything about it.
Yes.
So how can we get trained, or is there any coaching, sorry, which can help us in this?
Yes. For part two, usually, not usually, like 100% of the times, people take coaching. You require, because part two is more about your practical. Like, it's not just your practical. It's like you need to be calm. You need to know what is right. You need to know what are the exact points that are required for you to clear the exams. So there is coaching that is definitely required, and there are multiple coaching centers. But the one that I had done was from Chandigarh in India itself. The name of the coaching center is ODA.
Okay.
And I think it is really good.
Okay.
It is very nice. So with me, what had happened was when I had come to India for my coaching, India went under lockdown because of COVID. So I couldn't get any coaching. And then I went on to an online coaching for the same, because I had already paid money. There was nothing that could be done. So I went for online. I learned everything online. We had all these communications. So the communication tasks are called OSCE. So the OSCE discussions, all of those was taught to us online.
Okay.
And then when I came back to Australia, I had a small setup here at home. And most of the students will have their own setup at home. So when I say setup, it includes a mannequin, a proper typhodent. There is a mask. There is a drainage pipe from where the water comes out.
You get all these things and totally.
Yes. Yes. Okay. So it's almost like your small clinic in place. You have your own compressor, your hand pieces,
we have
everything.
To purchase all these things.
Not everyone does it.
Okay.
Not everyone does it, but most of the students do it because you need some practice at home. And I'll also tell you why, right? Two reasons. One is the practical exam is $4,500 each attempt, which is nearly
2 lakhs,
2.5, 3 lakhs.
Okay.
Each attempt.
Okay.
The second is the pass percentage is really low. So when I say really low, each batch has 24 students. And from those 24 students, I have never heard anyone more than 5 from that batch passing.
Oh God.
So it's, yes. So we're looking at really small, very small numbers, very small numbers. And they are very particular about infection control. So there are certain ways how things work in Australia with respect to infection control, and that is standard. And you need to know that for sure. At least from the exam point of view, 100% you need to know that. There are certain ways that people communicate. It's not as easy as it was back in India. You usually, if there's something happening, we tell them, you know what, you need a crown and that's it. No, this is not what you can do here. You
Okay.
need to have a proper, like, you need to explain them A to Z, what's
Hmm.
happening in their mouth, what are the various possible options, what would you like to do. You can't force them for any treatment. You can just give them
Hmm.
options. If they want to do it, they do it. If they don't want to do it, they don't do it.
Oh, okay. Okay.
Yeah.
Okay.
So,
So having your
so the
so what you meant was having your own setup at home will help you understand. So what all things are there? The mannequin you told, typhodont, compressor,
yes.
drainage pipe.
So those are the basic stuff that you need, right?
Okay.
Everything that you need in the clinic. So you will have a mannequin, which is basically is going to be a patient.
Hmm.
You have your compressor, your handpieces, high speed, slow speed. You have
Okay.
all the possible burrs that are required. So there is everything again is given very well in the practical handbook of ADC. So
Okay.
they tell you exactly what instruments will be provided in the exam, what material, what are the brands of the materials that are going to be used, right from composite to the temporary material, everything A to
Oh,
Z.
very good.
Yes. So all of those basic stuff will be ready. I mean, ideally you should have it. And again, coming back, I know I'm skipping and then coming back again. With your part two, one is your communication, second is your practical exam. So practical exam has 6 tasks. So the task, like it includes crown preparation, then putting a provisional crown on it. You have a complex amalgam restoration. You have class 3 or class 2 complex composite restoration. You have endo access opening, and you have class 2 cavity prep. So
Oh.
all of these tasks,
So in the practical exam, is it
you
on typhodont itself or on patient?
no, it's on Typhodon, but interestingly, it has a very nice chair. The whole setup is so beautiful. It's as if you're working on a patient.
Okay.
Literally, it's like a chair that reclines. It has everything is just like how you would work on a patient.
So it's not like the college typhodont which we have.
No, 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 it's not at all like the college Typhodon that we had. And even the way the exams are evaluated is very different. It is not like what we used to do in college. It is very different. So sharps protection, how you take care of the patient, even though the mannequin is the patient, but still you don't pull the cheek a lot. You don't turn the head a lot. You sit in a
Hmm.
proper posture. Your ergonomics, your everything comes into play. So
Okay.
everything's being watched. Every chair has a video camera on top for the exam, and they are monitored continuously. So
Okay, okay. And you told about that coaching which you have taken, right? So if it was
yeah.
online, how was the practical, like this mannequin and all? How did you do that?
So obviously, I knew that I had to do some practice at home before I gave my exam. So I had my setup ready. It was just an unfortunate incident that I couldn't take a coaching in person. So when I
Okay.
did the the online sessions were done brilliantly by a sir there, and I used to just take help from those sessions and practice at home on mannequin, take photographs and send it across to sir. But now things have changed a lot. Obviously, now you can go and get yourself trained personally, but I had done that way. I had taken that route.
So overall, if we see the cost structure, it is around 40,000 for the documentations. It is around 1 lakh for the first exam, theory exam. It is around 2.5 to 3 lakh for the practical exam. So overall, it will be around 4.5 approx.
5.
4 to
Yes.
4.5. Okay. So
Yes.
that is for one attempt. So if you are repeating
That
whichever
is one.
theory or the practical, accordingly, that cost will be extra.
Yes.
Now tell me
Yes.
one thing.
And
Yeah, sorry.
quickly, before I forget,
Yeah.
once you clear your part one, you only have 3 years to clear your part two.
Hmm.
And I think you can only give 2 attempts each year, because how part two works is there are there are 4 or 5 sessions each year. But by the time you apply for the session, then you give exams, the next session has already begun. until you're waiting for your results. So you miss those 2 sessions.
Okay.
So basically, even though there are 4 to 5 sessions open every year, you only get chance 2 times a year.
Oh, okay. Okay.
They also have certain eligibility criteria and things like that, which they keep on publishing. But yeah, so you have 3 years from the time you clear your part 1 exams to clear your part 2.
Okay. So let
For
me,
some Yes,
sorry.
for some unfortunate reason, if you don't clear, you
Mhm.
start the whole process again, right from the documentation, part 1 and then part 2.
Okay,
Yeah,
but it is possible. It's not something that we
it
can't
is
apply
possible.
at all. It is possible.
No, it is possible. It is possible if you have the money and if you have the mental
Stamina to do
capacity.
that.
Yeah, yeah,
Okay.
yeah.
So if you see on the time frame for the first, the documentation process, how much does it take? How much time does it take?
I would say easy 2 months, six to
Okay,
eight weeks, easy.
easily.
Yes,
So 2 months for the only documentation. After that, we
yes,
have 2 years of time where we can give 4 times the theory exams
yes,
to clear the theory
yes,
exam. Once the theory exam, the part 1 exam is clear, we will get 3 years of time where we can apply for appear for the exam for 6 times overall, because 2 times every
yes,
year, right? So
yes,
that
yes.
way, 6 times we can appear for the next. Okay. So 4 times for the
Yes,
theory, 6 times for the practical in one
yes,
cycle. Or else we have to repeat the whole
yes,
cycle again.
yes, yes.
Okay.
And even the coaching gets booked up. So there are many coaching classes.
Hmm.
I recommend the Chandigarh one because I have done it personally, and I know the difference and the efforts that are put in compared
Okay.
to the other places.
You can
So
send us the
and
link.
even cost
We'll,
wise.
add
Sure.
that link in the description so that the followers, it will be helpful for them.
Yes. Yes, and they are booked out well in advance. Any coaching usually are booked out well in advance. So if at all you know that you've cleared the exams for part
Hmm.
one,
Hmm.
just without thinking, wherever you want to go, not just this Chandigarh place, any place that you want to go for your coaching, if you know that you're going to give your exams part 2 in 6 months time or something, just get yourself booked for the coaching because you need the time for preparation. It's difficult to even understand. You need some time to even understand what happens in part 2 to start
Hmm.
with.
Hmm. Hmm.
Once you
Hmm.
actually start learning and talking to people, you'll have a better idea as to, yes, okay, all of this is required in part 2. It's not just a few things.
And how much does the coaching cost for the practicals?
Around the same. So the one that I know, right? Again, the
Yeah.
Chandigarh one is the most economical, and
Okay.
the price is I think price is 3 lakhs at this stage. Three
Okay.
lakhs for 5 weeks, if I'm not wrong, around 3 lakhs for 5 weeks. But if you come to Australia, it's quite a lot more.
Hmm.
Uh, it's 3 weeks coaching for 5,000, $6,000, $7,000. There are coaching classes for $10,000, $12,000 as
My
well.
God.
So
Okay.
yeah, so it's a lot. It's not just
And how does the result is published? Like after how many months or how many weeks are the result published for theory
uh,
as well as practical?
theory is usually a month's time,
Okay.
and practical is usually 6 weeks to 8 weeks.
Okay. So 1.5 to
6 weeks or so.
2 months.
Yes,
Okay.
yes. And
Okay.
they email you personally saying that your result is out, and
Okay.
then you have a link and you go and click and see if you have passed or
Passed
not.
or failed. Okay. 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 Great.
Yes,
Okay. So that is a whole. It's a little complicated. Like on the
it
first go,
is.
I think many of our followers won't be able to understand, but they can, revisit, listen to everything
Yes,
because you have explained it very nicely and with examples, so they'll understand it better. I would really ask them to,
yes,
just listen to this once again so that they'll understand what are the different stages because it's little complicated. It is explained in the ADC
100%.
website, but when somebody like you is explaining who has gone through that process, it's really helpful for them.
No, 100%. And I'll tell you what, even if anyone who's planning to apply, I would really advise don't think of part 2 right now because part 2 is a bit complicated. get to part two, when you actually reach there, you can start exploring it more. It is a lot of things that are happening in those 2 days time, and just take it slow. That would be my advice. I had absolutely no clue until I actually started studying. To tell you the truth, when I was actually my exams had got delayed, but when it was ideally supposed to be in May 2020, but because of COVID, everything got cancelled. Until March 2020, I had absolutely no idea what all is included in part two. It was so much. And that
Okay.
is when I had gone to get my classes in Chandigarh, but there was a shutdown, but I had absolutely no idea. So it's fine if you have no idea. It will be a bit overwhelming in the start, but then you get to know what's exactly expected and what's happening.
So you had gone through a lot during the lockdown period, I think.
Yes, I have. But it's
Okay.
helped me. It's helped me in many ways. So yeah, I'm very happy with the
Super,
delay
super.
as well.
So, Dashika, if somebody like a intern is applying for the EDC exam, what do you think? Like,
Mhm.
what time frame should he or she have in mind that within 1 year will they be able to clear the EDC and go there and start searching for job, or should they keep 1.5 to 2 years in mind?
I would say 1.5 to 2 years.
Oh.
The only reason being, to tell you the truth, what actually even helped me a lot was because I'd done masters. So when you have a little more experience as well, it
Hmm.
helps you with the whole clinical knowledge. And it's a fact, right? As soon as you're
Hmm.
a pass out from college, compared to that, and you compare yourself 4 years, 5 years down the line, your knowledge has improved so much because there are so many experiences, like patient experiences and cases, that help you actually come to a decision that you make. Uh, so I would say yes, it is going to be, it's going to be fine, but it's not going to be like an easy cakewalk. You will have to really give yourself a lot of time and put in a lot of efforts to understand more.
Hmm. 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 Hmm.
Would be my I think that is going to be really the advice.
Okay, okay, okay. Fine. So we have to keep in mind 1.5 to 2 years until we get a job over there
Yes,
and we can shift personally. So
yes, yes,
now let's talk about your journey. How was your journey? And you mentioned earlier that you have worked as a DA. How did that help,
yes.
or is it useful? What do you recommend?
100% useful. And I would ask everyone who's giving exams as well, because the way things work in Australia is very different to what the way we work in India or any other country as well. Here, I had no idea as to how it works. And because I had some time, I started working as a DA in a very good clinic, lovely, lovely clinic. I had no experience as a DA as well. I didn't even know how to hold a suction, right? But here in Australia, the DA does everything for you. Everything, A to Z, everything's done for you. You actually just get the patient in, just modify your notes a tiny bit, and then take the patient out. But
Okay.
they do everything. What helped me was infection control. My infection control was completely clear. I was like, I knew what I have to do in the exam thanks to my DA job,
Ah,
because that is what they follow. It's compulsory for everyone to follow that.
okay.
So that helped me, yes.
Awesome.
And then there are
Yeah.
small tasks as well in exam, like rubber dam is a compulsory task. You have fit and fissure, you have your x-rays. So just by observing, I don't know, like probably when I was working back in India, I have never done rubber dam. I had never done rubber dam in my life.
Hmm.
But just having a look, like how the dentists work, and then I would practice myself, keep everything ready for that 10-minute task, so that if everything's ready, the dentist just has to put the rubber dam on. So that was my practice period. I used to practice so many things during that time, the changeover time. So yeah, that has helped a lot.
Awesome, awesome. And I would like to ask you, like, if somebody is shifting over there, getting a job as a DA and applying for the work visa and everything, does the salary enough for them to survive there?
I would say it will be just enough,
Okay.
just enough, because on an average, as a DA, you get 23 to 26, $25, $26 per hour, depending on location, depending on the clinic as well. But that is the minimum that you should be getting. So
Okay.
considering that, I think if you work full time for 5 days, you would be having $800, around $750 in your hands, which is pretty good, which is very good, because your cost of living for a month would be around 1400 to 1200 to $1600, on an
Okay.
average 1400.
This
Yeah.
is apart from the tax and everything, or including like how is the tax
Uh,
system over there?
the tax system there here is a bit. So if you're earning less than $18,000, you don't have to pay any tax. But if you're, yes, if it's up to, I think, $45,000, you still pay around 20% tax or something. So again, everything's really written well in the ATO side, the Australian Tax Office, the cutoffs that are present,
Okay.
but it's not as bad. And because you are working as an employee, like you have different perks as well. Like it is very important here to have your pay slips. They give you properly as to how much of sick leave do you have, how much of annual leaves
Ah,
do you have. They pay for your superannuation, which goes directly into your account. So
what
there
is
are
the
many things that are.
superannuation?
So superannuation is just like your saving. It's a
Okay.
compulsory saving that the employer has to pay for an employee for their retirement. Yeah, so it's like a retirement saving
Oh,
stuff,
nice.
which is
Okay.
compulsory. Yes.
Okay. So
So
everybody
all
has
of
to,
that is
every clinic,
happening.
small, even if it's a small clinic, they have to do it. That's
They
pretty
have
good.
to do it. It's compulsory. Yes.
Okay, awesome.
Yeah.
And what about the health insurance and all those things? Do we get some benefit?
I think work on a work visa you don't have your Medicare. So here you have a Medicare card basically.
Okay.
So that is like a government health card. If you have your Medicare card, there is something called as bulk billing. So if there are your GPs, like your general physicians, or you have to take certain X-rays, you have to have certain eye checkups done. Everything's covered by the government for free for
Oh, okay.
certain practices. But as far as my knowledge goes, it is not applicable for work visa.
Hmm, hmm, hmm. Okay.
Once you have your permanent visa or you have a spouse visa, you have your Medicare card.
Oh, okay. Okay. Understood.
Yes,
And
but you still have your private health insurances. Yep.
okay, private health insurance. Okay. And how is the journey from getting a work visa and getting a PR, like a permanent residence there?
You can start applying for. So again, it's the same thing. They just want you to have certain points ready, your minimum points.
Okay.
Once that is done, you can start applying for your PR. Now, for some of them, it's very easy again, depending on the profession, the education, and things
Mm-hmm.
like that. The second thing, what they usually also do here is, so here we have our proper city, like we have Mumbai, and then we have Navi Mumbai, which is like another suburb or regional area. The same way in Australia, you have quite a few regional areas. So if you work and live in regional area, you get additional points because
Oh, okay.
the facilities are less, the what do you call, the way the job requirement is more and things like that.
Wow, okay.
But if you live in city, you don't get, the points will be less. So it again, as I mentioned, it keeps on changing depending on the requirements.
Ah, okay.
So this is how, if even if you're having your work visa, you can simultaneously start the process of your permanent visa, but you just need to have those checklists, like, yeah, okay, you've got that score, you've got those points. And they are opening up now because, see, one thing to know and understand is Australia is very much dependent on immigration. Everything is dependent on immigration. So because of COVID, everything was just complete shutdown. As the whole world might know that Australia was the only country who had their borders completely shut off for a very long time. No one was allowed to leave. No one was allowed to come in. We were the last to open up. So Australia is running behind in a lot of other aspects, meaning now they need everyone. They need the trainees, they need nurses, they need people to come in and help the economy. So yeah.
Okay. And like as you told that there are a lot of jobs opening, um, how,
Hmm.
how easy or how difficult it is to get a dentist job after getting the ADC license and everything cleared?
Dentist job is not difficult to get, to tell you the truth. So most of the dentists who are working here, right, they are mostly immigrants. Important to understand. Very few Australian, like there are, I wouldn't deny the fact, but not as much as we Asians and Indians. Like we like to study a lot. We like to become like give in those years. So many of them are us. A lot of job opportunities are present. Lots and lots of job opportunities are present. So there is not no shortage at all. Yes, you take some time to find the right job. That is for sure because everyone works differently. But that's about it.
Okay. And how to apply for jobs? Like, is it through online medium or we have to personally go and visit the clinics?
No, so you look for jobs via seek.com. So there's a site called seek.com, indeed.com, and then you might have some forums on Facebook as well where you're looking for jobs. They advertise for the jobs. If you feel that yes, it's suiting your criteria, it's close to your place, you're happy to go and see what's happening. They usually leave your email address. You send them a cover letter, you send them your CV, and then you wait for their reply or follow up in a week's time as to what's happening, and then that's how it goes. There's usually an interview for sure because it's a job, obviously, but that's about it.
Okay. And what salary can they expect?
Right. This is a good question. It is basic start, I would say, will be easy 80,000-90,000 per annum.
Okay.
So that comes to 40-45 for a general dentist, and that's the basic. But once you start gaining experience, it's pretty good. It could be around uh probably 2-3 years down the line, 130, 150 would be the minimum. 100, 130,000 to 150,000 should be the case.
Awesome.
But there are dentists who are like 4-5 years down the line and they earn like 300-350,000 per annum.
Okay.
So
Okay, that's huge.
Yeah, that's huge. That's
Yeah.
far off, but yes, that is what I've heard as well. So yeah.
Okay, great. And how is the specialist? Like you have done your masters in India, right? How
Yes,
does the licensing for the masters differ?
it's very different. So to start with, even though I have my master's degree, probably I can still help diagnosing here. Diagnosing as in if I'm working the place that I'm working, if there is any, I've done my master's in oral pathology. So if there is any suspicious lesion in the mouth, I would have an idea. They can call me and just ask me to have a look as to what am I suspecting. But I have no authority to give a diagnosis or to treat the patient, even though I have a master's degree. However, uh, in those terms, if you are an endodontist or an orthodontist or a pedodontist, it's going to be easier for you because uh, here as a general dentist, same as we do in India, they do everything. So you don't need a master's degree to redo an endo basically.
Okay.
Usually, as a general dentist, if there is a reinfection in an endo-treated tooth, I would refer the patient. But if you are already an endodontist from India, you have the knowledge, you are really at a very good, in a good position because everyone would love to have you in their clinic to do all the endo cases. Yeah.
Okay. Awesome.
And
if you want to take
if
a
you
license,
have to,
yeah.
yeah, if you have to take a license, usually there are APRA. So there is a body called as APRA, which is the Australian Practitioners Association, Regulation Association or something. And they usually have a path where you can apply for the licensing, but I have never seen anyone get a license in reality. So they usually tell you that you have to repeat your master's. This is just from one or two of known people who have had their masters done in India. They've applied for their specialization, but they've not got it. So I don't know if there was any other missing information. I have personally not tried myself, but if I want to get a master's degree in Australia, I have to do a 3 years course here.
Okay. And how does the life of a dentist, as you have worked here also, India also, and Australia also, how does it differ? What are the things which you found it completely different in Australia?
It is very different in the aspect. So, you know, how the best part that I used to love about India is that you can have breaks in between. So, you know, you would work from 9 to 2 and then you have 1 or 2 hours, not 2 hours, but you have quite a lot, some few
Yeah.
hours break and then you come back. It's not the same here. When you
Okay.
start at 9 o'clock, you have an hour lunch break, but you still be in the clinic itself. And then if there are patients, you have to see the patients. It's not like, you know, your lunch break is never fixed. It can be 12 o'clock, it can be 3 o'clock as well, and then you get done by 5 o'clock. Usually that's the time. So these are long. It's I feel it's more tiring here because the worst part for me is, you know, we are so used to talking in our regional language, and you know, the certain acts of doing certain things certain way.
Yeah.
But here it's like you have to follow a particular like what particular custom, the way you talk, the way you're always welcoming, you're always smiling, and you're always courteous, and you're always, yeah, so many things. So you have a lot of pressure on yourself,
Okay. And
and you have to do a lot of talking.
okay, okay. And like in your clinic, wherever you're working, there, do you have more of an Indian population or the Australian, or how is it?
No, it's mostly Australian population. The place where I'm working, the patients are lovely. They are so beautiful, like amazing patients. And that is one thing here as well. I've seen, like, it is just a general rule usually that you're just very polite to each other.
Mhm.
That's how it is. Very few times that I've come across with a very rude patient. They are very polite, very nice, but
Okay.
mostly the place where I'm working, it's all Australian. I had a lot of
Yeah.
trouble understanding the Australian accent in the beginning. I was really struggling with the Australian accent because it's very different to
God.
even the normal, like the US accent. But then, yes, you get used to it. It's fine.
Okay.
Sometimes, if you don't understand, if they laugh, you just laugh. That's it. That's all you do.
हाँ, मतलब the emotions and all जो है वो तो same ही है.
Yes, the emotions are the same. You understand that, okay, he tried to make a joke, so you laugh. Or sometimes I even have my nurses, like, once everything's done, I'll ask them, what did he just say? And they'll explain it to me. So I was like, oh, okay, fine.
Okay,
So
great,
it's
great,
fine.
great, great. So I
Mhm.
think we have covered a lot of things, Darshika, here. So I think, Darshika, we have covered a lot of things till now, and it is, I think, very helpful to our listeners. First, we have discussed in depth about the ADC exams, the part one, part two exams, what all things come, about the mannequin, everything about it. We have discussed about the coaching centers and all. But I would really want to ask you one main thing is that if any
Sure,
young dentist is planning to come to Australia, what
sure.
advice would you give?
Oh, just be confident. You have got it. Trust me. Easy to do. The best part is the way we are trained in India. It is really good. Any college you take. I have been so blessed to have that training and the knowledge that the way we have been given, and it has helped me all through. So if you have your basics clear, there is nothing to worry about. Here, they don't want the extra knowledge. They don't want you to show how much you know. They just want you to show, and they just want to know that you know the basics. That's it. The basics. Very, very, very basic. That is it. Nothing else. Nothing else at all. Yes. So, and we know it. Every dentist who's graduated from India knows it. So, yeah, just be confident. That's it.
Awesome. That's the best advice because everybody, has this dilemma in their head before going there that how are the life there. That is something which is very important and the first thing that comes to your mind कि पता नहीं कहाँ पे कैसा है, job है कि नहीं है, because जो भी हम लोग search करते हैं, it's need not be the updated one, right? But
Yes.
talking to
Yes.
you and जब आप टोटली अभी का करंट सिनेरियो बताते हैं, इट विल बी रियली हेल्पफुल टू द लिसनर्स जब उनको समझता है कि ओके देयर इज नीड, हम कर सकते हैं, ओके इट टेक्स सम टाइम, 1.5 to 2 years हमें टाइम फ्रेम माइंड में रखना पड़ेगा. दीज आर द थिंग्स व्हिच आर
Yes.
actually very crucial and very important, and it will help a lot of
Sure.
dentists. So thank you
No,
so much,
100%.
Darshika.
No,
Thank you
my
so
pleasure.
much.
My pleasure. And anyone, if anyone has any questions, feel free to text me, message me. I'll be more
Super.
than happy to help anyone.
Definitely. So seriously, let me know if you have any doubts, guys. She will help you a lot, and we would like to do a question answer session also. Maybe अगर बहुत ज़्यादा आ रहे हैं, बहुत लोगों को queries है, तो we'll do a question answer session जहाँ पे live
Sure.
रहेगा. तो उनको जो भी doubt है वो आपको सीधा directly पूछ सकते हैं. Thank you so much, Darshika,
100%.
for
Sounds
taking
great.
out time from your busy schedule. I know it's night over
Oh,
there
no.
right now. And
Yes.
probably your husband must be waiting कि यार आ जाओ
No.
खाना खाना है.
No. All good. It was all, the pleasure was all mine, Laksh, and it was lovely to talk to you as well.
Lovely talking to you, Darshika. Thank you so much.